How does a biopsy diagnose lymphoma? When it comes to diagnosing lymphoma, a biopsy plays a crucial role. But how exactly does this process work? Lymphoma is a type of cancer that originates in the lymphatic system, primarily affecting lymph nodes. To confirm the presence of lymphoma, doctors often need to examine a sample of tissue. This sample is usually taken from an enlarged lymph node, which may be a sign of lymphoma or another condition. There are several types of biopsies that can be performed. The excisional biopsy is the most common method. In this procedure, the entire lymph node is surgically removed. This approach is preferred because it provides a large enough sample for accurate identification of lymphoma and its specific subtype. If the entire lymph node cannot be removed, an incisional biopsy may be performed. In this case, only a portion of the lymph node or tumor is taken. There are also needle biopsies, which can be either core needle or fine needle aspiration. These methods are less invasive and involve removing smaller tissue samples. However, they may not always provide enough material for a definitive diagnosis or detailed classification of lymphoma. Once the tissue sample is collected, it is sent to a pathologist. The pathologist examines the tissue under a microscope and may use specialized tests, such as immunohistochemistry and molecular studies, to identify cancer cells. This analysis is essential for distinguishing lymphoma from other causes of lymph node enlargement, such as infections. It also helps differentiate between types of lymphoma, including non-Hodgkin lymphoma and Hodgkin lymphoma. In some cases, a bone marrow biopsy may also be performed. This test checks if lymphoma has spread to the bone marrow, which is important for staging the disease. It's important to note that a biopsy is the only definitive way to confirm lymphoma. Symptoms and imaging tests alone cannot reliably distinguish lymphoma from other conditions. Doctors often start by evaluating symptoms and may prescribe antibiotics if an infection is suspected. However, if lymph nodes remain enlarged or continue to grow, a biopsy is recommended. In summary, a biopsy diagnoses lymphoma by providing a tissue sample for detailed laboratory analysis. This process confirms the presence of lymphoma cells, identifies the lymphoma subtype, and guides treatment decisions. Understanding this process is vital for accurate diagnosis and effective management of non-Hodgkin lymphoma. Always consult with healthcare professionals for personalized medical advice and information.